Hi, my name is Dr. Robin Abramczyk, and I'm a general dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and we actually practice holistic and biological dentistry here. And I am here with our rep for NuCalm. Her name is Michelle Weakland. Hi. And she is going to share with you a little bit about NuCalm. It's something that we have integrated recently into our practice. We're very excited about it. And tell us a little bit about it.
So NuCalm is a patented neuroscience technology that lowers stress and improves sleep quality. Wow. So we're in 7 industries over 5 continents, dentistry being one of them. We started in dentistry 6 years ago because when we put the brakes on adrenaline and cortisol, you have a very calm, still relaxed patient. Patients love being relaxed in the dental chair. It's a unique experience. So you've invested in an amazing technology.
We love it.
Good.
Yeah, we love it. Yeah, and I love that you alluded to cortisol and the nervous system. So most people, their autonomic nervous system is dysregulated. And that's partly due to EMFs or just not getting out into the sunshine, and they carry this anxiety, and then they come in here, and then when they're back like this, that automatically puts them into a sympathetic or fight or flight state.
Exactly.
So the goal of NuCalm is to get them out of that and into the parasympathetic.
Perfect.
How do we do that?
Well, we basically flip the switch on that stress response, because you're right. It is an unnatural position for us to lay on our back with our mouth open and having someone's hands in their mouth. And so
very personal.
It is a very personal space. Our mouths are used for eating and intimacy and not necessarily fingers and work going on in our mouths. So basically NuCalm flips the switch on that stress response and brings the body to parasympathetic nervous system dominance. And we mimic the body's natural process for deep relaxation. And we do that in 2 ways. We communicate with the brain chemically and electrically. So we use the NuCalm cream. And the NuCalm cream contains neurotransmitters that we naturally produce in the body called GABA A and GABA B and L-theanine.
Love it.
Yep. So this is externally applied to the carotid artery. 1 pump on each side, 1 pump on the right,
and then you would do one
pump on the left. Yep.
Awesome.
And then we use what we call a cranial electrotherapy stimulation device. And this device here has 2 neural patches at the end.
Awesome.
We place 1 patch behind each ear on the mastoid process.
Yep.
Patient doesn't feel anything at all.
Not at all.
But what this allows the brain to do is to help open up the receptor sites in the brain to receive the GABA.
Alright.
So our brain normally receives GABA right before we fall asleep at night. And so when we're in sympathetic nervous system dominance, those receptor sites are closed. So this helps create that cell permeability to receive the GABA.
I love it. Okay. And then what about part of the thing is the lights, or they are just very anxiety producing.
Yes.
And the sounds.
Of being in the dental chair.
Yeah.
Yep. So we use a light blocking mask or these sunglasses that just absorb some of the light. So when we close our eyes naturally, we're just automatically relaxed. It signals our central nervous system that it's safe to relax. So it is a critical component to the 4-part system of bringing the body to parasympathetic nervous system dominance. Okay,
and then what about the sounds? The hand so loud, that shrill.
Yep. So the other way we communicate with the brain is through neuroacoustic software. So the patient listens to really soothing music. We have 4 different genres. We have classical. Everyone loves the spa.
I love the spa.
I love the spa too. Guitar or piano. So that's more, the music is more of an ancillary component to the technology. Really, what's doing the work is the neuroacoustic software that's embedded inside of that music.
How does that work?
So what we do is we use a binaural beat or frequency following response technology.
Wow.
That is a mouthful. It is fancy. It's incredibly sophisticated. And so are our brains. Our brains are really good at recognizing patterns. And so what we do is we constantly trick the brain. And we oscillate that binaural beat between alpha and theta. and we're constantly tricking it and bringing it between alpha and theta brainwave function.
And alpha and theta, how is that important?
That's a great question, and right now we're in beta. We're functioning in a beta brainwave state. Anxious patients or people that are in a highly anxious state are in high beta.
Okay.
And we're probably in middle beta. If you're super chill, you're in low beta.
Okay.
And then alpha and theta is the similar response to right before you fall asleep at night. It's that first stage of sleep where your body starts to feel really heavy.
Yeah.
You're still thinking, but your mind is wandering so much you're not carrying a linear thought. So your patients are still thinking in the chair.
They're responsive.
Yep.
Yeah.
They're able to turn or open or close.
Right.
And so the noise does dampen out a little bit of the drill, but you can still hear the drill.
It's still those
just a little
waves
bit.
that are embedded
Exactly.
that help the brain get into that relaxed state.
Yep.
Okay, that's wonderful. So this can also be used along with nitrous.
Absolutely.
Yeah.
Yeah.
That's great. We've actually done that and it's extremely effective.
Awesome.
We also have a massage therapist here that works on our patients and who
Amazing.
also uses essential oils
Awesome.
if they want. And so that's wonderful, and everything combined just really does help to put that patient at ease and takes the edge off.
Yep.
Yeah. So what is this contraindicated in any patients?
So any patients with a pacemaker or a cochlear implant, pregnant and breastfeeding women should just listen to the music.
Yeah.
And
the massage, of course, for them, especially them.
Yeah, definitely.
Yeah. They could always a little nap, right?
Absolutely.
So if a patient were to listen to this for a certain time period, is it like getting rest or?
Yeah, that's a really great point. So when our executives that travel all over the world or our athletes use NuCalm, they really like it for a quick way to gain a lot of energy, because the research done at Harvard, 45 minutes of NuCalm is equivalent to 2 hours of restorative sleep.
That's amazing.
It is amazing.
That's amazing.
Yep.
So you talked about this being used in many different industries.
Yes.
Are there any industries that our viewers would like to hear about? I think you mentioned.
Yeah. So professional athletics. We're in oncology at the Hippocrates Center.
Oh, that's
which
amazing.
Is so amazing.
So
Helping out
amazing.
a lot of people.
Holistically.
Absolutely.
Yeah.
Definitely.
That's great.
Aviation, cardiology, professional athletics, which I think I mentioned, and I'm drawing a blank, but we have a few more.
Wonderful.
Yeah.
I love it.
Yeah.
That's so great. Well, I appreciate you sharing this amazing technology. We're very excited to have it
Thank
here.
you
Our
so
patients
much.
love it.
Good.
It's made a huge difference.
You've done a great job bringing in a neuroscience technology so that they can leave feeling more refreshed than when they walked in the door. So I commend you for all that you're doing. You have an amazing practice.
Thank you.
Yeah.
Thanks for sharing. And thanks for joining us today.